To India now, where the country is kicking off what could be the world's largest immunization drive for COVID-19. The first phase starts with vaccination for healthcare workers across the country. SABC News correspondent Ishan Garg brings us up to speed with the preparation ahead of the rollout from New Delhi.
India's ambitious drive to vaccinate 1.3 billion people starts with 3 million healthcare and frontline workers. Almost 300,000 healthcare workers will be inoculated on day one of the vaccination drive, and the government hopes that by the end of July, which is when the phase 1 of vaccination will end, it will be able to inoculate 300 million people, including the elderly and the vulnerable. Prime Minister Narendra Modi is expected to interact with the first beneficiaries virtually. Regulators have approved 2 vaccines for emergency use, the Oxford AstraZeneca jab, which is being bulk produced by the Serum Institute here, and the locally developed Covaxin, which is currently undergoing stage 3 trials. While some experts have criticized the government for approving an under-trial vaccine, the government says it is confident of its safety and efficacy. A recent survey indicates that almost 80% of Indians are willing to get vaccinated, but experts say most of them will have to wait a long time for their turn. India's second worst affected country by COVID-19, trailing only behind the United States in terms of overall confirmed cases of coronavirus. And while the daily caseload has been dipping, officials say that a vaccine is the only long-term solution to the pandemic. But they're also saying that people must maintain all necessary precautions, such as putting on a mask or maintaining social distancing until they're all vaccinated. A process which, according to experts, could take up to 3 years. Ishan Garg, SABC News, New Delhi.
Let's now get the latest from our correspondent Neha Punya, who joins us live from Delhi, New Delhi in India. A very good morning to you, Neha. Thank you so much for talking to us this morning. Now, India has begun the process of vaccinating 300,000 healthcare workers. Talk to us about how this process is supposed to work.
Very good morning to you. And the vaccination drive here in India, which is possibly one of the largest such efforts anywhere in the world, is well underway. It started this morning at about 10:30 local time when Prime Minister Modi addressed beneficiaries through a video link. He spoke about what a momentous occasion this was for India, that has seen 10 million cases and more than 150,000 deaths in the last 8 months. And he expressed hope that this was the beginning of the end for COVID-19 here in the country. We're going to see 300,000 early beneficiaries. These are healthcare workers getting inoculated on day one itself. These will be people who will get their shots at 3,000 vaccination centers, 100 people getting vaccinated at each center, including the one that I am at currently. There are 2 vaccines that India has given emergency authorization to: the Oxford AstraZeneca jab, which is being deployed here, but many other centers are also using a locally developed candidate called Covaxin, which has been manufactured by Bharat Biotech. That vaccine is still undergoing clinical trials and efficacy data isn't out yet, so there is some unease surrounding its deployment on the ground. But the entire process could take more than a year. The health minister says in the next 2 weeks, 10 million healthcare workers will be vaccinated, following which 20 million frontline workers will be targeted. Following that, India will target 270 million at-risk individuals or those above 50 years of age. So it is a mammoth task. Prime Minister Modi acknowledged this, saying that many countries don't even have 300 million citizens, and here India is hoping to inoculate as many people by August in the first phase itself.
So we understand that 2 vaccines, Covishield and a local drug, Covaxin, will be used today to administer to people who have the option to choose between the 2 vaccines. Tell us about this.
That's right. So these are 2 vaccines that the government has granted emergency authorization to. They're very well suited, the government says, to the Indian climate, because they don't need to be stored at sub-zero temperatures. They need anywhere between 2 degrees to 8 degrees freezing temperatures to be transported to different parts of the country, which works for India because that's what the existing immunization program and the logistical system surrounding it currently has capacity to do as well. Here at this center, Covishield, which is the Oxford AstraZeneca jab, jab is being administered. In other centres, 5 other centres here in Delhi itself, Covaxin is being given. And you're right, candidates don't have a choice because each centre is getting only one vaccine. They will not be allowed to pick which vaccine they want to get, but anyone who is getting Covaxin, which is still undergoing clinical trials, will need to give their informed consent to the medical professionals administering the vaccine. They will be monitored very closely, and the government says that these individuals who get Covaxin will also be treated as part of the final clinical trials. But there is some unease surrounding that because many people say that the approval was hasty. There was no need for India to deploy 2 vaccines when there is no efficacy data for one of them. But the government says that there's no need to worry. India is a vaccine powerhouse. It produces 60% of the world's vaccines, and the process followed to approve this vaccine was the usual process, which means it is safe and Indians have nothing to worry about.
I hear what you're saying, but it's such an important conversation. The issue of, as you say, Covaxin still undergoing clinical trials, even though government is giving assurances. But it's a global conversation about the efficacy of these vaccines that are being spoken about. What's the response from the Indian population in terms of government administering a drug that has not fully been cleared?
Well, the reaction is mixed. Many citizens say that they'd be happy to take the shot because it's been cleared by the government. They must have done so after following due procedures. But there are many others who say because a vaccine that is still undergoing clinical trials, that does not have efficacy data published, has been deployed, they will choose to wait and watch. They will not volunteer to get vaccinated immediately. There are many health professionals who've questioned this as well, saying the entire approval process was opaque. There was no reason behind this entire emergency authorization being given to a candidate that does not have proven efficacy data. The company has gone on to defend its track record as well, said that we will publish efficacy data by March, but many experts say that's already too late because millions of Indians will be given this vaccine in the coming days. There's also concern, of course, because already there is high vaccine hesitancy in a country like India. There are some surveys that have shown that 40% of Indians say they will wait to get vaccinated, but the government claims its own surveys have shown that 80% of Indians trust the vaccine. So it's a mixed bag as far as reactions to these vaccines are concerned. Many people even believing that COVID-19 is on the wane. India has been seeing less than 20,000 cases every day, and that might make getting people to agree to get vaccinated a lot more difficult, but certainly this whole conversation surrounding Covaxin is something that's complicating matters here in India.
Of course, as the vaccines are being rolled out, Prime Minister Narendra Modi having to defend his decision to continue to place the country under lockdown. Tell us about why there was a need for the Prime Minister to come back and defend himself in terms of this decision.
That's right. Prime Minister Modi, when he addressed early beneficiaries and also the nation at the launch of this COVID-19 vaccination drive, made a reference to what happened in March when, with just 4 hours notice, he shut the entire country down, a country of 1.3 billion people, something that was unfathomable before that day. But Prime Minister Modi said it's not easy to shut down such a massive country, but he said it was a decision that needed to be taken. He said it was difficult because he knows that many people lost their livelihoods, but it was for the greater good because he claims that is what helped India stem the tide of COVID-19 infections. Of course, the jury is still out on that one. Many experts say that the lockdown was hasty. It was imposed at a time when India only had 500 cases and lifted when cases were still rising. I mean, for example, in October and September, when India was seeing nearly 100,000 cases a day, there was no lockdown in place. Lockdown restrictions had been almost entirely done away with. So Prime Minister Modi is still facing criticism from opposition members, at least on that count, which is why he came back to that today, saying that that was the start of India's fight against COVID-19.
Yeah, thank you so much for bringing us up to speed in terms of developments in India as the whole world battles COVID-19.